So really one of the main reasons we're having this entire discussion is because there's been a number of changes, as both of you know, when it comes to the pharmacy, especially around controlled substance prescribing. That's a hot issue, obviously, with the opioid epidemic, which has been raging on. What we know about the opioid epidemic is it's changed significantly from really being mostly prescription opioids that were, implicated in these overdoses to less than 10% of all overdoses, even involving a prescription opioid at this point, and most of it coming from illegally manufactured fentanyl now. Some would argue, and I think rightly so, that that has to do with a lack of access to proper care. I think there's been a cooling effect. I think that's been well demonstrated because of the regulation in the space. But whatever their cause is, we know that patients are having less access to the medications that they're being prescribed. And we know that there's several reasons why it's hindered, but I guess, maybe you can share a little bit about what you're seeing, both of you, as it pertains to the issue. You both get prescriptions for controlled substances from time to time. In the real world setting, what are you seeing? Robert, let me start with you. What are you seeing when it comes to those challenges and patients not being able to get those medications? What's that look like?
Absolutely. So it's multifaceted. I think there's distribution issues, which is one side of it, to where can we obtain the control medications that we need to supply for the patients that need the medication. And then from that point, it's can we fill it? If we have it and we can fill it, well, ratios come into play, other things come into play. Is the patient new to our pharmacy? Because a lot of patients that are trying to get a pain prescription, if you take that to a pharmacy they haven't been to, they're not going to fill it. It's not going to happen. So maintaining that and ensuring that our balance for the patients that we take in allows us to service every patient that we have. And those are the two big things that I see: the distribution, and then also just ensuring that because if we can't get it, our suppliers are going to limit us. Then we can't serve the patients that truly need it.
Yeah. And are you seeing some big challenges, Robert, at the pharmacy
Oh
level there? Of
yes,
course, you are. Okay.
every day, every day. I mean, it's no matter what supplier you're purchasing from, or no matter what new patients, if they're in pain, they're going to need a pain medication, and a lot of times that's going to be a control medication, and that's definitely a huge limitation in these days.
Got it. Thank you, Robert. Mark, you mind weighing in on that? What you're seeing?
I really appreciate how granular Robert was able to go there too. I mean, when you're boots on the ground and you're experiencing these things, it's asking the easiest questions ever, right? But even in the bigger picture, we seem to be in this pendulum always with everything. We happen to be talking about pain and controlled substances today, but it's one extreme to the other. And I could click a button and get whatever I want, and pretty sure they'd offer me something for hair or lack thereof if I did. But the other stuff, we lock it up like no other. And it that pendulum, the extremes, is really, where it's at there. But the interesting thing in healthcare, in pharmacy particularly, is there's a lot of legit reasonings for those consternations along the way. We've been navigating John, you brought up the whole opioid epidemic, opioid crisis, whatever label we use. It long time now has swung over to the cartel side. I mean, that's even the headlines have caught up to that. Yet we're still getting the kidney punches in healthcare. And we do need our checks and balances. We need to go on the right road, of course. But let's at least pave the road. Let's not, use the Flintstones mobile to get down the darn thing for our patients. It's tough.